COVID-19 numbers are surging in the Thunder Bay region. We talked to Minister of Health, Patty Hajdu. It's James with Net News Ledger. Joining us by Zoom is Minister of Health, Patty Hajdu, the MP for Thunder Bay Superior North. Welcome back to a Wednesday, Thursday, Monday, Minister.
I was just saying that to my team this morning. I have an oddly exciting, monotonous job all at once. How is it that a life in politics could be so monotonous? It's just the nature of sitting in front of your screen for 10 hours a day, right?
Well, the kids do it with an Xbox.
They do somehow, but don't they even start to feel a little fuzzy around the edges after a while? I don't know.
I'm feeling fuzzy today. We've just done a major upgrade of our website with Sensia Canada here in Thunder Bay. So I'm excited
Oh.
about that. I am not excited about the changes in the numbers we're seeing with the COVID-19 numbers across Thunder Bay District Health Units reporting.
It's listen, James, we're in a scary moment here for our community. 61 cases today. It's Thursday. Yesterday it was in the 30s, the day before in the 40s or 50s, and the numbers keep mounting. I was hoping that yesterday we were starting to see a trend downwards, but then today came out with such a high number as well. I think you probably saw too the wastewater surveillance that's underway, which is great, but it's showing, that we do have a high level of COVID here in the community. So this is a critical time. We've got people getting sick, some people getting very sick. We've got hospitalizations, people going to the hospital, having to stay there, growing, more people in ICU, and of course, sadly, a number of deaths. And this isn't, all this is predictable. When your cases go up, a portion of people will get so sick that they need care, and then a portion of those will die. And so it's pretty real. And there are things we can do to help bring down those numbers together. Those of us who can stay home should. We should work from home. We should order in, our groceries or get curbside delivery as much as possible. Stay out of stores and other kinds of places where people gather, and support those frontline care workers and those other frontline essential workers, bus drivers, pharmacists, grocery store workers that have no choice but to go to work. So
Yes.
we can help. We can be part of a solution, which is to not get sick ourselves and not spread the virus even further.
I was startled today. The numbers in York with 1.2 million people are only slightly higher in new cases today than Thunder Bay. So your message echoes really, really seriously. Do you think that the area should be going into more of a stay-at-home order?
Well, I think that, listen, I'm not even really sure at this point, where we're at. My understanding is we are in an emergency handbrake situation where obviously restaurants are not open and salons, hair salon, hair salon. I didn't get my haircut during that brief window where I had an opportunity. Now I'm regretting it. Hair salons and nail salons and the like are not open, so all those sort of personal care salons are not open. But there are always things that need to stay open. Grocery stores, for example, come to mind. I
Yes.
think, but again, people need to take this seriously. I mean, this is not the time to gather in the backyard. It's getting warmer. I know people want to get together. This is not the time to, have a small little dinner party with just your closest friends. COVID travels very quickly, and it can infect people very quickly. So this is the time to actually buckle down for a bit longer. And I know I hear people say, I can't do it anymore. I'm tired. I miss my family. I miss my friends. But this is like our first wave. We have to take this very, very seriously if we expect to save lives.
And that's a good message to share with everyone because I know it's difficult. You want to, oh, hey, how come I can't this? How come I can't that? We're at war with a virus. And so maybe we have to look back into our history and look at how some of the sacrifices everyone else has made in the past. And hey, we're up to those too.
Yeah, and that's a great way to think about it. It's a personal sacrifice we're making for our health, but also everyone else's health around us. We all know people who are vulnerable in our lives, and you can even be vulnerable, James. I could be vulnerable. We don't know necessarily who's going to.
Mhm.
Who's going to get really sick, who's going to die. There's some obvious trends, But then there are people in their 30s and 40s and even younger who maybe they have an underlying health condition. Maybe they're just run down. Maybe they have a poor immune system that's permanent or temporary. I mean, this is the problem. The virus kills some people, and it's hard to predict who. And it's a tragedy every time. So we have an opportunity to save lives by hanging in tough together for a little while longer and doing the Zoom to connect with our friends and family and really trying to protect those people that don't have an option to stay home. That is what we have to all remember. There's a bunch of people that can't work from home that have to go out there and serve us every single day.
On the vaccine, that's our light at the end of the tunnel we've been talking about. What's the status? What do our readers and viewers need to know?
Well, first of all, that we're getting way more earlier than we thought, which is great. We've got more Pfizer coming, a million, almost a million this week, another million plus next week, and that's the trend line: is more and more and more variety. AstraZeneca was recently approved, as you know. Where it's looking positive for an approval of Johnson and Johnson. Um, that one I think we may not get immediately, but we'll definitely have it approved so that when the doses come, we don't, we're ready to receive them. And at the end of the day, we've also got new advice from the National Advisory Committee on Immunization, the independent body of experts that look at the vaccines that are available to Canadians and give advice. And their advice, based on international data and even Canadian data from Quebec, is that we can prolong the gap between the first dose and second dose of all three and still have very good protection. And so they're recommending that provinces and territories get that first dose into arms as quickly as possible to save as many lives.
And probably in closing, Minister, the one thing that we should be making sure we're doing is protecting our mental health.
Oh, yes. I think we're all a little bit weary, but some of us more than others. And obviously, people living in really difficult situations. The number of people that are parenting and working, for example, from home, people in difficult relationships, people with substance use issues, people who are lonely. It's so normal to feel lonely and tired and exhausted and discouraged. But we do have supports. And I would like to remind everybody of the free federal support, wellnesstogether.ca. You can go online, you can check out your own, you can do a self check, you can get tools and tips, but there's also paid professionals that you can access for free in both official languages with translation into 60. So tell your friends and family about this free resource, completely paid for by the federal government.
Minister, thank you. And until next week.
Take care. Great to see you, James.
To keep up to date, you have to subscribe. You have to hit that like button and hit the notification to stay in touch.